Good morning, everyone. My name is Donald Ngonyama. I am the Deputy Director at NACCW, and I will be chairing the webinar for today. Thank you very much for all the people who joined. We know that you have joined as individuals, and some of you are joined in watch parties. And we have people joining from different organizations. We have people joining from the Child and Youth Care Centers and from organizations working with children. I think I saw one or so people from a university. And we also have people joining from the Department of Social Development. And if you have not been mentioned, please feel welcome. And thank you very much this morning. We are meeting on the 25th of September this morning, with our speaker today being Nicia, who is going to be introduced properly. But I felt that I need to just make a few points in my opening remarks as I welcome everyone. That we are in a month that is a heritage month a heritage month coming from a heritage day yesterday. And I think that you will agree with me that throughout the country, our cultures and traditions have been well celebrated. It was very colorful in the pictures and the news as I watched them yesterday. And this also continues throughout the country in our child and youth care centers and organizations. We, as child and youth care workers, we do have a responsibility to teach the young people about and to encourage them to take pride in their cultures. So well done for doing that. I am aware of other activities that are planned by organizations and child and youth care centers and other forums that will, I think it will proceed until the end of this month. So it is a very important month in the South African calendar. And so in those words, you are welcome. And I am now going to request our guest speaker, Jonathan Geldenblum, who is a long-standing member of the NACCW, who is going to introduce the guest speaker for today. Before Jonathan comes in, I also want to mention that we are asking people to please put down your names on the chat box, indicate the organization that you are coming from, as well as your registration number with council and your email address. That's very important because we are collecting this information and we will be able to communicate if there is any important information that we want to reach you. We will be able to use the contact details that you are giving us. Another point is that these webinars have got CPD points. This one we have applied for CPD points, and we are hoping that they are going to be granted. So they have not been granted yet, but it's important that you register so that you also are able to collect your CPD points as we have these sessions. So with that, thank you very much. Can I then request Jonathan to introduce our guest speaker for today? Jonathan, thank you.
Good morning. Thank you, Mr. Deputy Director, Mr. Donald. Thank you also for the welcome. Good morning, ladies and gentlemen. Good morning, NACCW directors and staff. Good morning, NACCW National Chairperson.
Sorry, Jonathan, can I ask that you put up your video if that is possible?
I will do that.
Thank you. You may proceed. We can see you, but we can't hear your voice now. Jonathan, if you can hear me, you are either on mute or there is a technical problem on your side.
Sorry, Donald. I think it was just a technical problem on my side. Because can you see me now?
Yes, we can see you and we can hear you.
Thank you. Ladies and gentlemen, it's my honor this morning to introduce to you our speaker for the day. Well known to the NACCW, she is the Monitoring and Evaluation M&E Manager at the NACCW, the National Association of Child and Youth Care Workers. She's been working for the NACCW since 2012 and is currently managing the M&E department at the NACCW, exploring the application of routine monitoring and evaluation for measuring impact for children and youth through program implementation. She's also currently a doctorate candidate at the University of Cape Town's Department of Psychology, conducting research on the characteristics and the pathways of child survivors of abuse and neglect in South Africa. Child Protection System. Ladies and gentlemen, let's put our hands together for Nicia de Nobrega. Thank you.
Thank you so much for that introduction. Let me just put my video on. Let's see. Okay, you can all see me, right? Good.
Yes, Nicia, we can see you. You are bright and colorful. Thank you very much. I also want to welcome Christina from Adoption Centrum in Sweden. Christina, you are welcome. We are very, very happy to have you with us. Nicia, so you are speaking to the international world now.
Oh, goodness. Good. That's good.
Okay.
All right. Okay. So let me put my video, my sharing on so that we can go to the presentation quickly. Let's see. So I hope everyone had a good Heritage Day yesterday or Braai Day or long weekend if you were off on Monday. Everyone's back and fresh. So thank you again for the introduction. I'm Nicia. You know, what we're going to do today is just go over the NACCW Child Safeguarding Policy. And the reason we're going over this policy is because it's a critical document to have in an organization. And what we hope to do is in this session, you can apply this policy in your own organizations. If you already have one, maybe it needs an update. If you don't have one already, you can use this as a way to create one. And we'll also be sharing our actual policy in Word document to you. So you can always use that as an example for as a template for your own child safeguarding policy in organization. The PowerPoint will be available afterwards, and the webinar will be uploaded in case you miss anything. So you'll be able to access it after the fact. Okay. And then there's a Q&A at the end as well. I don't know, maybe we'll see how it goes. I'm not going to take the whole 2-hour session, I must admit, so it's not going to be that prolonged, but then we'll see how it goes. Okay. So the child safeguarding policy, let me just see here. Okay, let me just move this. Okay, I hope you can all see my screen. I'm sure you are. So what is a child safeguarding policy? So The policy, the whole purpose of the policy is to protect children who come into contact with the organization. In our case, it's NACCW. Protect them, safeguard them from risk of harm and abuse caused by the people who have a duty to protect them, like our employees from the organization itself, their staff. And if abuse or any maltreatment occurs, where we involve to respond appropriately. Okay, so I think, sometimes the word policy can be a bit intimidating in itself, but really a policy, it doesn't have to be a 30-page document. It doesn't have to be a 40-page document. I think ours is like about 10 pages, but it's a succinct document with clear steps on NACCW's approach, commitment, code of conduct, and the steps that we have put in place to respond and safeguard children from being harmed by being in direct or indirect contact with us as an organization, especially because we are a children's organization that work with children. This document is a critical document in place. It promotes good practice and ensures the safety and protection of children. Who it applies to is to our permanent and temporary employees, all the board members, volunteers, and interns. We don't really have volunteers and interns, but where we do have, it applies to the people that are representing us as an organization and our employees. Okay. Before I go to the next slide, when we did the child safeguarding policy, we didn't just think about the sections all by ourselves. There was an organization, now I'm not going to get the right name, but Keeping Children Safe. It was based on the international standards of child safeguarding that we applied. And I'll share the link at the end of where this resource came from. And that international stand helped us set out and write our safeguarding policy. And just to say that this policy is not meant to replace any kind of legislation that is mandating an organization or people to respond to child abuse and maltreatment. It's meant to sing and support all the laws that we have in place if something should happen to a child in our watch or in any circumstance where we know something has happened. So it's meant to be a clear step-by-step document that runs alongside the Children's Act, its amendments, and the Sexual Offences Act. But I'll speak about that in a minute. So how do children come into contact with an organization? Now, it depends obviously on what, your organization does, but in our case, and in many other cases, it's their attendance at events, workshops, conferences, or any activity that is hosted by us as an organization or our representatives or partners. So a clear example is the youth conference that's held parallel to our normal conference. Also the youth forums, so many activities, the safe parks, any activity where the children gather and we have our staff in their life space. Not just the attendance, but also their travel to the events, to the workshops, to the conference, whether it's by public transport, private transport, even walking or flights. So the actual travel to the event. Sometimes you have the children or the youth, the young people as volunteers or interns, maybe at the Safe Park, or they are in our offices, whether it's Cape Town or Durban or Kimberley. Or even the visitors can be our employees' staff, their children. Maybe they have their little one in the office for some reason or other, for any reason. Any direct or indirect communication with NACCW. So there's just some examples, but maybe they approach one of our employees at some venue or at some or a text or a phone call. There's also the use of children's stories and images. Just a reminder to please, if you can just mute your mic. But the use of children's stories and images.
Nicia, please hold a bit. There is noise and there is also echo. So please, colleagues, Tabile, I see you've got your hand up, but you also, if you can also mute yourself. Okay, we'll attend to Tabile's hand later.
Yeah. Okay, thanks for that. So use of children's stories and images, and I just want to pause there because, you know, you kind of, when you think about contact with the organization, sometimes you jump to physical contact and verbal communication, but the use of children's images and personal information is super, super important to keep in mind in this policy, because sometimes it's done with good intention, but aligned with our POPIA, and I'll talk about this also, it's in one of the slides, but to not share or disseminate their images or names or any details without consent in place or at all. So you'll see, even in the slide, you can see I've got 2 pictures, but you don't see the images of the children. There's no way to identify them. So the little boy, I think that's one of my favorite pictures, but this little boy is writing a poster on children's rights, but there's no way that you'd know who this little boy is. And the other picture, all the children's faces are turned away. So either the pictures, you can't see their face, sometimes we blur the faces, sometimes you put an emoji on the face, or we just don't use the photo at all. In fact, shouldn't take the photo without consent in the first place. Or we take the photo, but then there's a consent form that's been signed off by the caregiver and the child for their image use. So that's also one way that children are in contact with the organization, when their pictures are taken at whatever activity. Sometimes the children are involved in research studies by NACCW, or somebody that has consulted, a funder that has consulted a third party to do research with NACCW. And we just have to be mindful of how those researchers or field workers come into contact with children, and how we protect them and safeguard them, and what consent and processes we have in place there. And then the use of children's data in M&E purposes, using their personal information, how we use it, and in what ways we use it, and who has access to that data as an employee of the organization. And just to say, look, we're only going through the child safeguarding policy, but we also have a data privacy policy linked to POPIA. And in actual fact, maybe at some session in future, we should have a webinar speaking to the POPIA documents, because if you don't have that, well, you should, but if you don't have that in place, having the data privacy policy is part of being POPIA compliant, and it links to this safeguarding policy, another important document an organization should have. So it's the safeguarding and the data privacy. Okay. And then there's other ways they can come into contact. I didn't put all of them. If you have any ideas that's not on this list, you can go ahead and just put it in the chat box. What other ways can they come into contact? Anyway, you can just put there if you have any other ways that they come into your organization. I mean, obviously, if you're a child and youth care center, there's very clear, you know, they're actually based at the organization. That's another means. So how we structured the safeguarding policies in 4 sections. The first section is, and I'll go through each one in detail, but the first section is on awareness raising and education on child safeguarding. So what we have committed as an organization is to ensure that all staff and the people we work with are aware and educated on child abuse and risks and child maltreatment. So it's part of the education and informing people of knowing what it is inappropriate behavior from employees and staff, but also what is child abuse and neglect in South Africa, and trying to put that as information education as step one, as the basis. Okay. Step two of the policy covers prevention and minimizing the risk. So how do we put things in place to safeguard them more what's the word, to put more measures in place to prevent it, around safe recruitment, and our HR policies, vetting employees and how that's done. That's the one element of trying to prevent it, and the safe program design. So obviously, if you whip up a program last minute, haven't done really much assessment of who's going to accompany the child, who's facilitating, something that isn't really done, to the, tick one's ducks in a row. Anyway, having safe program design is the other section in the policy that we cover. And then identifying and reporting concerns, child safeguarding concerns, and we'll cover what those are. So there's a whole section in the policy that covers this part. And it ensures that staff and people with the organization and parents and children are clear about what to do, what steps to do when something arises. So if there is a disclosure of physical abuse by an employee, what do we do next? And this policy covers those steps. And then lastly, which is linked to actually number 3, is responding. So the actions, the exact actions of what to do when something happens, and what are the possible outcomes to the employee and to the child, and what we've put in place to respond appropriately if something arises. Okay. So these 4 sections is what the policy includes, and then we'll go each one in detail. Okay. So the safeguarding policy starts off with the purpose. You'll see when you get the template, but it starts with the purpose, and then it has a little bit on what is child maltreatment, but then it has a section of code of conduct. And the code of conduct, here's some of the sections from the policy, is split into appropriate behavior that we expect from the employees and inappropriate behavior. Okay. And so this code of conduct is within the policy, but I just want to stress that again, it's aligned to the legislation on child abuse and neglect, but also for your code of conduct, not code of conduct, code of ethics as a practitioner, as you're registered with the council. So that code of ethics is aligned to this aligned to legislation. So it all syncs together. It's not necessarily new information, but this policy's code of conduct has what we expect is that employees treat children with dignity and respect and not discriminate against them based on gender or any other factor. We expect that employees respect the cultural values of children, not enforcing their own particular values, for example, on a child. That the employees explain your role and purpose. So if you're a facilitator of whatever activity at the conference for youth, that it's clear role, clear purpose, and people know who you are and what you're there for. Written parental caregiver consent for attendance, for travel, for participation in NACCW programs. And I think, we should actually also share our consent form, just so you can see an example of what that would look like when we ask caregiver consent on child participation and also on the use of the information. Be a positive role model. I mean, we're not expecting somebody to be perfect, but, being at the airport on your 7th beer while you're accompanying a child to the conference is not at all appropriate. You know what I mean? So be a positive role model. Encourage open communication, listen, and take concerns seriously of children. Responsible behavior if working with children in private or unobserved situations. Sometimes children might disclose to you something one-on-one, and so you are in a private space with a child, and being responsible within that space if you're in that position. Touching should be open and non-secretive. We're not saying no touching, at all, but with transparency and clear guide, and with permission, except obviously emergencies where you have to, touch a child. And then confidential information not shared, like we said with POPIA, except through formal mandated reporting, where you have to report a case to the police or social worker, or with the fact that there's a consent form in place. The consent form is very important. I probably will say it another 3 or 4 times in this session, because the consent form signed by the caregiver, assent given by the child, or consent given by the child, those two, that's critical for protecting the child, the caregiver, and the organization. And then working in partnership with your teammates, your colleagues, and other agencies to protect and safeguard children. It's not necessarily going at it alone, but if you have to bring in the social worker or your supervisor, definitely has to be involved as well. So making sure that you're not in isolation from your team. And then, like I said, mandatory reporting for any form of abuse and neglect. So if a child has disclosed abuse or neglect, maybe from their own caregiver, if they disclose from another child within the organization or activity, or if they've disclosed by an employee, another worker, or the facilitator of a program, any form that has been identified, observed, disclosed, suspicions of, has to be investigated and then reported. And then the legislation kicks in. Like I said, the Children's Act as amended and the Sexual Offences Act, depending on what the abuse was, if it was sexual abuse, and then Form 22 completed, and then the necessary child protection organization, whether it's police, social worker, or a DCPO, an organization that handles those cases. And then if you accidentally hurt a child, so this is inappropriate behavior, appropriate behavior, because obviously sometimes things happen. If you accidentally hurt a child, or, knock them and they fall down the stairs, whatever, or the child is distressed or aroused sexually or misunderstands something you did or said, report immediately to your supervisor and the child safeguarding officer. So, and I'm going to explain who this officer is, because that's in the next section, but, and then for investigation, okay? And then you'll have your team, your child safeguarding team get involved and speak with the child, speak with the worker, and then actions come into play after that, okay? And then, like I said earlier, adhere to the profession's code of ethics, right? So that's still in play and is still relevant to this as you are registered with the council. And anything contrary to that then is risk for disciplinary, etc. And then undertake a risk assessment prior to carrying out a program. I'll put up the risk assessment because the policy, is, your 10 pages. Oops. Spam. Anyway, you've got your 10 pages, and then the risk assessment is your addendum, your annexure. And the risk assessment, what it does is when you do a program, it gives you like a checklist, have you evaluated X, Y, and Z for the venue, transport, facilitator. It's got all these checklists that you can tick yes or no. If you tick no, it's a red flag. Okay, it's putting the child at risk. I'll go through that risk assessment in a little bit, okay? Inappropriate behavior So a lot of this is the reverse of the previous slide. So you got your discrimination, preferential treatment to the detriment to exclusion of other children, shouting, bullying children, offensive, abusive, or threatening behavior, swearing at them, intentionally physically or verbally intimidating the children, beating or hitting them, withholding food, water, or other necessities, asking them to stand in a corner for 2 hours, just inappropriate behavior linked to physical abuse, emotional abuse, restraining children physically during activities without the staff member having proper training and without another responsible adult present as a witness. Now, what that appropriate restraint is depends on the circumstance. If a child is beating another child to a pulp and you're having to intervene and having to restrain a child, but like I said, with the required appropriate training in place to do that. And then withholding medication, failing to administer it, or providing incorrect dosages neglectfully or intentionally giving them incorrect dosages. Shaming, humiliating, belittling, degrading a children is linked to the above thing. The shouting part sentence. Emotional abuse, I said. Physical, sexual, inappropriate relationships, suggestive conversations, flirting with children. I mean, that's what is that? Comments, texting, emails that are out of the bounds of appropriate behavior. Exposing a child to inappropriate images, films, websites, pornography, violent images, and videos. Using enticing methods such as giving money, toys to win their trust for selfish interests. Now, we're not talking here, about donations or things like that, but using these, giving these items for your own benefit and malicious intent. Holding, kissing, cuddling, touching a child in inappropriate, unnecessary, or cultural insensitive ways. Sleeping in the same bed as a child with you who you're working with. Assisting children, assisting children with tasks in a personal nature that's not part of your job, or that a child can do themselves, like changing their clothes. Now, obviously, it depends on the context. Some of these depend on the context. So if it's a child with a disability where you're having to change their clothes, it depends. Some things don't need context. If you bully, swear at a child, or slap them, that's not on, in any context. Really, but here with helping them with a task, you just have to, one has to judge the actual specific situation there. Photographing or filming a child without consent. Again, even with good intentions, one has to be careful with that. It's without consent, it's not within the POPIA compliance. It's not, Working under the influence of alcohol or drugs, leaving a child unsupervised where they could be at risk, and allegations of abuse by a child not acted upon. So ignoring if they've disclosed, for example. So these are examples of inappropriate behavior, and you might have other examples as well. Like I said, you can just pop it into the chat so we can see what are some of your organization's examples of the code of conduct that you have. Okay. So when I said about the child safeguarding officer, the policy puts in place, look, there's no point in writing a policy and then not having it well implemented. So what we have done, we have a child safeguarding officer that holds, their role is to oversee the implementation and review of the policy. So if the child safeguarding officer is replaced by somebody, the new person is put in there. They make sure that actions are taken forward. They make sure that the investigation is going according to the steps. And normally, so the example that we saw on the standards was that they appointed one person, But what we've done is we've rather chosen to also appoint a deputy safeguarding officer so that they work together as a team. And we've also appointed a safeguarding team that includes 3 other people. So in actual fact, we have a child safeguarding team at NACCW made up of 5 people. It depends on what your organization, if you want 2 or 3 people, but we tend to think that 1 person only holding this might be just too little. You never know what happens. So 2 or 3, a team of 3 is quite helpful, especially when investigations come into play and you need those extra people to assist with the process, okay? Because it's not an easy thing if a child protection concern is raised and you need experts in that area to help. Then, okay, where am I with time? No, we still. So like, remember earlier we said the policy is split in 4 sections. The first section is on awareness raising and education. So here the idea is to make sure people understand what the policy is, understand what its purpose is, and understand what is child protection and safeguarding. So job contracts and agreements refer to this policy and they are signed. I wish I could just highlight that word signed here, but they are signed, okay? So the policy the child safeguarding policy, at the end of it has a declaration which we ask staff to sign off so that we can show, okay, you've read the policy, you've been informed of the policy, here's the inappropriate and appropriate behavior, you've signed it off, that you understand. And other documents like your job contracts and so on refer to the child safeguarding policy so that you're clear that this is NACCW's approach and commitment to protecting children and that you are liable as per our policy, in addition to your code of ethics as a practitioner. Also orientation, so implementing just basic training on child rights, children's rights, and child protection for staff. Orientation on this policy, and I wouldn't be amiss. So keeping records of the training registers, so that we make sure that all the staff and people are informed. Again, not creating a policy without implementing it properly. And you can't implement it if people don't know about it or are not trained in it. And then the child protection policy. Now we don't have, so the child protection policy is the sister policy to the child safeguarding policy. Now, the child protection policy is a more detailed document that goes through the specific steps of reporting child physical abuse and sexual abuse and neglect, linked to programs that child and youth care workers implement in schools or in communities. And it helps to show, exactly what is mandated reporting, exactly what is sexual abuse between children, how do you report, who do you report it to, what do you expect when a case is reported to the police or to whoever. So the child protection policy is a close document aligned to legislation, and it's NACCW's more detailed policy because not everyone is 100% understanding or trained in the acts. So the child protection policy puts in those steps in much more detail. So the safeguarding policy is got its purpose here. The protection policy has got its other purpose, which is more detailed, but it should be trained and understood together. And what we could do is also actually share that policy. So, you could end up, I think we have, and it might sound a lot, but we have about, let's say, 20, 30 policies, but all with specific purposes. So you got your POPIA data privacy policy, safeguarding policy, protection policy, 10 pages, 10 pages, 10 pages, so you're not going to end up with a massive 100 or 200 pages, but you need your policies to protect yourselves as an organization and also to make sure that things are actioned appropriately if something happens. right? Where are my children and caregivers? Okay, along with education, your children that come into your activities and the caregivers are given information about how NSSW should act with them during this activity and generally in the program, and how they can raise complaints, which we'll speak about that just now. But children, they have to be made aware as per this policy, and compulsory training annually on child abuse prevention and management, and on this policy, and any new employees that come in. And then all donors and relevant partners are made aware of the policy. We're having a shortened version as well for those third parties. And you'll also notice that, if you're applying for funding, some of the donors do ask if you have a child safeguarding policy, and some of them ask for you to share it. So this document is an important document because, people are not going to necessarily support an organization that doesn't really have steps in place to assure the safety of children, Then prevention and minimizing. The first is safe recruitment of staff, and super critical with recruitment and selection processes, criteria. So, your phoning of references, and making sure that the three it's actually done. Assessing, are they registered as a practitioner? Are they vetted against the National Child Protection Register or the police clearance, depending on who the worker is? And your HR policies. So there is a staff policy that is linked to the safe recruitment of staff, and that kicks into play in addition to this one. So those vetting processes, performance, and then ongoing performance management and staff supervision and mentorship, continuously in line with the recruitment and their supervision. And then safe program design, so this risk assessment procedure, you use that checklist when you do a program, and that you adhere to the POPIA Act, linked to your organization's data privacy policy. I'm just going to quickly put up the risk assessment procedure so you can see what I'm talking about. Hopefully you can see it. I'm sure you can see. So the risk assessment procedure is a risk assessment to be taken when a new program is designed or implemented. And it's a checklist to identify possible risks and actions to address them. And who completes them is the facilitator or the program manager of the activity. So let's say we're talking about a youth camp. No, the youth conference. So you'll have the person who's responsible, the date that this is done, and then you've got your checklist. So here's basic information about what is the program, youth conference, purpose, all of that, venue. And then part B here is your actual assessment. So it's asking, are the roles and responsibilities of all staff involved in implementing the program clear? So are their roles clear? If yes, that's a green flag. That's good to go. Do all the staff involved have training, including safeguarding training? If no, that's an immediate red flag. And what are the actions to take place? So train in policy, or whatever you need to do. Have all the staff sign the policy? No. So now you got to train and sign and keep record. Okay. Then there's other sections. There's sections about the venue. Is the venue able to provide sufficient bedrooms to the children and child youth worker ratio? Are there other guests in the venue? Here's a question about alcohol. Is it sold or consumed at the venue? If there's a pool area, is it fenced? If it's not fenced, what are the safety measures in place? And then you have, I don't know, there's always a person, whatever measure you have. But you can see the questions are asked here for you to think about them. Transport, is it a private company? Is the child being accompanied by an NACCW employee? Who is the employee? Vehicle safety questions. There's quite a lot of vehicle safety questions here. And activities. Is at least one staff member trained in first aid? No. That's a red flag immediately. Imagine something happens, no first aid. So look, it's a 3-page risk assessment, but it's good for activities. Just sets out the questions nicely for you to yes, no, partial, and then put in some reasons. So if, touch wood, something should happen, you refer to your risk assessment and say, okay, this is happening. So not just going by judgment or intuition, but you actually have pre-planned and thought about what you're doing if something happens. Okay. We are nearing the end almost. So after preventing and minimizing, we were just talking about how to reduce the risk as much as possible. But if something should happen, we should know how to identify it and how to report it and respond to it, which is where this comes in. So the first thing around identification is that staff should be informed or educated, which comes with the previous one, about what are the signs, what constitutes a child protection concern or possible abuse or abuse if you've witnessed it. So, for example, if a child has an injury where there's no satisfactory explanation or the child is behaving, in or appearing in a way that raises suspicion or concern, something doesn't seem right, or a child has straight out disclosed, or a caregiver, or you have witnessed or seen a text between another employee and a child. There's various ways that a concern could be disclosed or identified, or suspicions of it for investigation, and all should be taken with seriousness and take it to the child safeguarding officer. Reporting. So firstly, we report after identified. The policy puts in place reporting abuse as per legislation, and then the child protection protocol kicks in. That's got more details about that. To a child protection authority. Who is a child protection authority? The child protection system in South Africa has 3 child protection authorities that you can report abuse to. The one is DSD, office social worker. The next person is a child protection organization, depending on what organization that is. Child welfare, for example, could be one of the child protection organizations. And the third is the police. Those are the 3 child protection authorities that you can report child abuse to with Form 22. And then you ensure that the child receives appropriate medical attention immediately if injured. All right. So if that injury is linked to the abuse or if it's linked to accidental, but ensuring that the child receives immediate medical attention. Reporting to the direct manager and child safeguarding officer, critical, so that this can be responded to with the people that have expertise in the area. Act to secure the safety of the children who you observe in the process of being harmed, if safe to do so. So, if children is wielding a gun and, what are you going to do? But if it's safe for you to do so and intervene, 2 children are fighting, and you're trained and intervening in that in a safest way possible. Providing details of the incident in writing, very important for recall and for putting it down on paper. What happened, child and youth care workers adhering to the profession's code of ethics, So again, referring back to the code of ethics there. And then safeguard records and information as per POPIA and data privacy policy. So, you're not going to go tell your best friend, that this happened to this child on this day, and this is what your organization is doing, etc., etc. So confidentiality, important. And then complaints by children and caregivers. Information is provided if something should happen or concern is raised, that the organization, NACCW, provides the information to the children and caregiver, and a complaint system is in place for parents and caregivers to disclose and raise concerns anonymously or non-anonymously. So, for example, your suggestion box, your complaints box in your office, or at the Safe Park, or at the youth camp conference. So having that as a platform that people can write any complaints to. But then also the whistleblowing policy, which is also a sister policy to this one, held in HR, where there's a contact where a parent or a child or somebody can disclose information anonymously, or they may put the information for the Child Safeguarding Committee to take forward. So and investigate. So especially if there's a senior member involved, or if there's even the child safeguarding officer is implicated, or if there's conflict of interest, or maybe the child caregiver or another employee just feels uncomfortable to just go to their supervisor, there is the box and the whistleblowing contact that can be used. And those are important things to put in place to make sure that the identification and reporting is followed or possible. And then lastly, responding to concerns, which we've already covered, but in short, so the actions taken to investigate complaints, like we said earlier, it's assessing complaints and reports that are received by the Child Safeguarding Committee as per the policy, and NACCW's documented disciplinary procedure, which is linked to the staff policy that we have in place, depending on what the situation is, okay, and the investigation is. Ensuring access to emotional support, psychological support to victims, witnesses, other staff, and alleged perpetrators, again, depending on what the situation is of the concern raised. But, if something has happened and we leave the survivor or the victim unsupported, that's not good practice. Provide appropriate training. We spoke about it before, but also after. If something happens, an injury, or there was no first aid available, or something happens, that a training and an action plan is put afterwards to avoid it happening again. Providing feedback to complainants, children, caregivers, other employees, whoever's the complainant of the issue raised. Keeping a record of the complaints and reports and all outcomes, very important. Record keeping here, and then following up. So, following up on complaints to the relevant people, whether it's to an outside person, social worker, police, and even if maybe that is taking its time, making sure that there's that communication between the complainant, the external party, and the organization, and making sure everyone is aware of what's happening and where the case is, if it's reported outside or if not. And what could happen with a complaint as an outcome? So a disciplinary inquiry might be instituted, and then that will link to HR's processes of what that could be, whether it's immediate dismissal, or again, it depends on the situation or not. Reporting that employee and the case to a child protection authority, whether it's police or DSD, depending on what it is, or a decision may be taken not to act if the complaint is deemed without foundation, again with proper investigation in place. All right. And it would be interesting if you've ever had, I mean, if anyone in this group, in this session has ever had an example like that, more than welcome just to put it out there so we can look at it. But that might be an example of an outcome. Or a decision may be taken just to gather further information before deciding to act, whether it's more interviews with the complainant, with another employee, with a person that's being implicated. We might need more information to gather before we decide, okay, what exactly is we going to do, which again is why the Child Safeguarding Committee team is so critical to assess that in the best way possible. And we are done. We are done. So, like I said, we're going to share the policy. What else did I say? We're going to share the policy PowerPoint webinar. And if there's any questions, there's the chat and Q&A. But I hope that this has been useful. And if you haven't done your child safeguarding policy yet, if you have done it, but it needs revision, or if you're an employee and you don't know that what is your organization's child protection policy, then you can ask, okay, do you have one? What is it? Shall we, being aware from all sides, whether it's organization or an employee, about what is the child safeguarding steps that you are obliged to adhere to, in addition to your code of ethics and legislation. We're done?
Thank you very much, Nicia. And I hope that the participants here have found this session valuable. I do not see any comments or questions on the chat box, but we are now going to open for questions. So if you would like to make a comment or you want to ask a question, you can please show yourself by raising your hand. Randy, please assist me if I am not able to see the hands.
And maybe since we have a lot of practitioners in the group, I mean, are there any other examples that weren't on that slide of appropriate behavior with children in your organization that wasn't on there already?
Yeah, thank you. I see Bongani, you've got your hand up. Bongan Mapanga. Please unmute, Bongani.
Hello, hello. Hello, sir, how are you?
We're fine, thank you. You may go ahead. We can see you and we can hear you.
Yes. Mine, I don't have any question or anything like to add. I just want to request, if ever maybe it's possible to get that that presentation policy so that I can go through with it. If ever it's possible, I can share my email, then send it to me directly.
Thank you. I believe you would have put your email on the chat box, so we will send it to you. Thank you very much, Bongani. I see another hand. There was another hand.
Yes, Donald, Donald, it was me. I just wanted to clarify. I understand that the webinar and the PowerPoint presentation would be available to everybody, but am I clear that I just want to clarify that the document, will it go out to registered, paid up NACCW members, and so that there is a record of who the document goes out to? Just to clarify procedure there.
Yeah, so as far as we're sharing that document generally to all people in attendance to this webinar. It's an open source document in a sense for that.
Can I also add that, I mean, for better benefits of these documents and the webinars, it's important that people do join and be a member of an up-to-date member of NACCW, so you get more benefits. We know that it is voluntary to join, but then if you are a member that is up to date with your membership, and then you get better benefits, because documents like this can easily come to you even more. Thank you very much, Zeni, for your question, and Nicia for responding to that. Silo?
Good afternoon, everyone. My question is, 2 weeks ago, we have received our certificates.
Sorry, Silo, there is background noise. Please, members, if you can ensure that you mute yourself. Thank you.
Okay. Okay, thank you. Can you hear me now?
You can go ahead, Silo.
Yeah. 2 weeks ago, we have received our certificates, me and my colleagues, a level 4 certificate. So we wanted to register with SACCP, CCSP. So we have emailed NACCW to ask for our academic record. So we haven't received any feedback from them since it's been 2 weeks now. And then hence I wanted to register for level 5. So now I'm scared to register with NACCW because we started our NACCW, our child and youth care in 2019, and then we finished in 2021 because of COVID. But we received our certificate last week. Hence, now we wanted to get our academic record, and then it's been 2 weeks now. We've sent them the email, but we haven't get any answer from them till to date. So that's the problem that we have at the moment with NACCW. So I'm done.
Thank you very much, Silo. And while that it's a different question to the matter on the table now, the matter that we are presenting today, it's a very important matter. I have just put on my email address. If you could please resend that email that you sent to NACCW to this email address, and then we are going to ensure that we address it as quickly as possible. And we apologize for the delay. You probably are one of the members of the Gauteng child and youth care workers who were trained, and we had a meeting with them on Friday last week, and we explained the reasons that caused some of those delays. But we are doing everything on our side together with HWCTA to ensure that those that have their certificates outstanding, they receive them as quickly as possible. And we have put in place other measures to assist you if you need to register while waiting for those certificates. So please do send to this email address and we'll address it. Thank you very much, Silo. Any other concern? I mean, any point that you may want to raise, please, with regard to the safeguarding policy?
I think just to say that, sorry, Donald. No, I just wanted to say that, I just want to say before we take a hand, there was a comment in the chat box by Lindiwe who said, who must give training for interventions when children are fighting, but the child and youth care worker is the one that gets injured while trying to intervene? And I think that is a good question, which wasn't covered in this policy. But definitely your HR person or people should have the steps and guide about what happens when injuries happen as an employee for the organization. So that would kick in within that particular protocol or policy. This one is more specific to children. But yes, when it does happen for the child and youth care worker, an adult and employee, that is required within the labor and HR processes. Okay.
Yeah. Thank you, Nicia, for responding to that. I see there are 3 other hands. I'm not sure if Bonga needs another question that you want to ask, but let me go to Des.
Good morning, everybody. I've just got this question, Nicia. Child and youth care workers report incidents, right? But it gets swept under the carpet, I would say, or they get threatened with their jobs. So how far can we go to report this then if something happens in an institution or in the COIC sectors?
Yeah. Nicia, before you
Sure.
respond to that, can we also take the hand from Fefe?
Good morning, colleagues.
Good morning, you may proceed.
Yes, my name is Nolu Fefe from Mpumalanga, Isibinde's Goleni. I just wanted to say thank you, Nicia, for this information. It will help us to also to protect us as child and youth care workers. Thank you so much, Nicia, for this informative statement. Thank you.
Thank you very much, Nolu Fefe. Yes, those were the 2 questions, Nicia. You may the 1 question and 1 comment. You may respond. Thank you.
Yes. Yes, thank you, Nolufefe. I think it is an important document to protect the workers and organization and children. And then Desiree, that's a good question. You see, the idea is that the Child Safeguarding Committee together would be able to address that as best as possible within the team. So if, for example, the employee uses the whistleblowing policy and reports in that manner, or they report to their supervisor, if that's not working, they should be able to go to the Child Safeguarding Committee. And if the Child Safeguarding Officer is ignoring it, then the deputy should come in and say, okay, well, now I'm coming into play, what's happening? Or the team, the extra 3 or 2 people should collectively then monitor that properly. And if that's not monitoring properly, I feel the director, it should be scaled up until something is done. If the director is not responding, sure, I mean, then we'll have to see who is that other escalation involved. If it's something to do that is a physical abuse or sexual abuse, like a matter that has to be mandated, then an external party would be involved. So whether it's a social worker or somebody else that comes into play. But yeah, definitely linked to the committee, the head of the organization, and external, depending on what the incident is.
Can I add to that, Donald?
Yes, Zeni, please proceed.
Yes, and I think that if it is physical abuse or something of that level of serious nature, it will have to be reported if you're a children's home to your board through your principal or director, and it will have to also be reported to the Department of Social Development as well. So I think that it would be important to look at the guidelines that are relevant for your specific program.
Yes, thank you. Thank you very much, Zeni, for that addition. We have 2 other hands, Beauty. And then after Beauty, Sheila, you will ask your question and then we'll respond to both questions once. Beauty.
Okay, thank you so much for this platform. I would like to know as to how are we going to promote this safeguarding committees in the workplaces, like such as children's home in the CYCCs, because there are those child and youth care centers that are independently, where there's a certain recruitment process that they use. Let me just make an example. I was in a training, I think 2 months ago, and I happened to have a discussion with a colleague there. And along the process, we happened to discuss maybe about certain things that are affecting us in the CYCCs. So we happened to have this conversation, and as we were going along with the conversation, then we tend to find out that there's a specific person that we actually happened. I don't know if I should say it was incident or what, that we happen to know the person that we happen to discuss about. So the lady actually advised that did we do the reference check before the organization employ that person, because where she used to work, actually there was an incident, and the person now is currently working with me, and there's certain things that I'm also seeing, which I feel that maybe in terms of safeguarding the children, there's lack of I don't know how to put it, but I feel that there's whatever that she was fired for, maybe it's still there. It still does exist, but I can't have full evidence in regards to say this is what I'm bringing to the table, as to say this is what I've seen, because other colleagues are reporting, certain incidents, but things are not being attended to. So I'm just asking if is there a way that we can promote in our workplaces the safeguarding committees, just to ensure that everything runs smooth in the organizations. Thank you.
Thank you very much. We'll respond to that. Let's take Sheila first.
Hi, good day, everyone, and thank you for this was a very, very good workshop. I thoroughly enjoyed listening to it, and the information was quite good. I think I just want to latch on to what Ms. Des was saying, because why I want to latch on, because I'm thinking of where if a child and youth care worker report an incident, right? They report the incident through the various people. People sit down and make a decision, or we sit and we engage, and we try to come up with a plan of how best we can work around the situation or the incident. But then what happens later on then, if it is that maybe a child and youth care worker was innocent in the case to what was happening with the incident, and then and if you do report incidences that that is pertaining a child, or the seriousness of the incidents that occurs with the children within the centers, if you complain about it or you report the incidents, then most sometimes, or where I come from, the center that I just recently come from, is then child and youth care workers are then victimized, even though you report it and you go through the process, the reporting process. Later on, then child and youth care workers are being victimized because of being the whistleblower at child and youth care centers. So I would then say some of the organizations don't have these committees, the safeguarding committees, because I feel this is very important that these committees should be implemented within the organizations. And some of the organizations, some of the directors and board members, some organizations, they don't speak a lot on this particular policy, because it's such a serious policy, and it's also it's a policy that will protect the child and youth care worker and the child, but because if I look at the child and youth care workers, don't have a lot of protection within the centers at the present moment. And if, especially with the type of child that is coming now regularly into the system, it's almost like the child and youth care. I mean, you have all this training, you have all this information, you have all the equipment, you have all the resources, but somehow the level of behavior of the children currently is in such a I don't have the proper word for it, but it's quite challenging and difficult for the child and youth care workers to work with them and try to find ways and means to work around the challenges and the situations that occurs on in the moment. So I would then want to know how to, like I think Bongi also mentioned it now, how then can NACCW help and assist in this matter to get the committees formed within the child and youth care centers. Yeah, so that child and youth care workers can also feel safe when an incident occurs, that they know that there is some backup, there is some form of safety space for a child and youth care worker also to connect with, because somehow our child and youth care workers now recently, they don't feel that there is a safe space for them to or a sounding board system that is there for them to assist them when incidents occurs or when they are maybe blamed for something that was not true, or a child did something and then make an assumption to the adult or whatever. So yeah, that is just
Yes.
my comment and my concern around that situation. So thank you very much.
Thank you. Thank you very much, Sheila. And yeah, Nicia, and I'm also going to ask Zeni to come in here to respond to one or two of the points that were raised, especially, in fact, on both of them, if you've got any additions. Thank you.
Yes. Nicia, would you like to start, or would you like me to make some comment?
Sure. Yes, I'll just start. So I just want to say those points are all very, very important, and I see a pattern between all of the three speakers in the fact that, so we first need to see if that child and youth care center has a policy in place. It's possible they might not have a child safeguarding policy, and we need to see how we can advocate for that center to create one. And then once created, we'll need to see who the child safeguarding committee is. So for example, with us, when we did this child safeguarding policy, we had written it up, and then collectively we decided, okay, who would be appointed the safeguarding officer? In our case, it's the HR manager, and then myself as a deputy, and then the director and two other people are linked to the team. But it's senior management within that committee that we've agreed to put in place as part of the policies steps. If there's resistance from a center to do the policy, or resistance from the center to appoint a committee, that's then a sort of a bigger, more tricky issue that one might need to navigate with the board or with the director, or depending on who the lead is. But it would be critical for the center to have the policy and then have that committee. And if still things are not coming right, there's victimization around the employees, if complaints are raised, that's not good practice. And the idea of the policy, to develop the policy, to develop the committee, is to promote good practice. And if that's not happening, then there's then the board and seniors and directors, depending on where that weakness is, would need to come on board. Because especially for child and youth care centers dealing with children on a day-to-day at the organization, this policy becomes more critical. And if they don't have that in place, they don't have the committee, and they're reluctant for some reason to appoint the committee. And the committee doesn't have to be somebody brand new coming from the outside. It could be somebody who's there, who's a director, or somebody at that level. And if that has that knowledge and who's the champion with maybe a second team member. I don't know, Zen, if you want to add as well.
You see, I think if child and youth care centers in particular, but other organizations don't have the safeguarding policy in place, then maybe, Donald, this would be an opportunity for the NACCW, when they hold their regional or provincial meetings, to actually focus on this, to go through the PowerPoint presentation again and have the child and the participants sit in groups, look at the policy, look at how they would adjust it to suit their own environments. And there might be added things for children, for childcare centers, and then look at that procedure. How would you take it forward? And if you have whistleblowers, how would you identify them? How would you protect them? And if there are whistleblowers, for example, in all the child and youth care organizations that are implementing the policy, there could even be an opportunity for them to come together to share how they've managed situations, and they feel protected in the fact there's not just one in one organization, but there are those that have that particular role to play in childcare centers. So it seems like this could open up a way in which we could embed, support, and diversify the safeguarding policy if it isn't in place. And I think that you pick up that the earlier person who spoke was saying that what if the HR processes are not in place and we end up getting people who have not had a reference check. The reference check is important, and whoever is making appointments must do reference checks. And we've heard that before, that sometimes people are employing people without those reference checks in place, especially in a childcare center. It's a very serious concern. And it feels like also the board members would need to be orientated to their responsibility in implementing the safeguarding policy and their responsibilities in this as well. So it feels that what we've done here is done a presentation that opens maybe further consultative work amongst us in the NACCW, so that we can be sure that all our members are implementing it in a sort of standardized way and in a way that is helpful to them, even if it's not standardized. Sorry, thanks.
Thank you, Zeni, and thank you very much, Nicia. And I don't see any other hands here, but I do see that we have some inputs on the chat box. I will go through them quickly. And the first one, it's from Lindy Wenkosi, saying, who must give training for intervention when children are fighting, and what happens if a child and youth care worker get injured while trying to intervene? I think Nicia spoke a little bit on that. I'm not sure, Nicia, if you want to repeat that, please. And then thank you, Nicia, for so much. Thank you so much, Nicia. This is it's very informative, and it also protect us as child and youth care workers. That's from Nolufefe. And another one is saying that my name is Zoli Matsebula, Center Manager from Jinda Child Care Center in Barberton, Mpumalanga. I'm not registered with NACCW. Is it possible for me to get the documents as well as my email address is? We've got your email address, Zoli, so we will ensure that you receive an application form to become a member. I have also provided a WhatsApp number. So please send a message to that WhatsApp number so that we can quickly send you the application form. You should get it within a short space of time if it's on WhatsApp. And then another point, it's medication dispensary. Is there any document that protect the child and youth care worker in schools for giving children their prescribed medication? As it is stated in schools, they say no medication should be given to the learner. Okay, another one. Children first, the speaker who raised the question about things happening at an institution and got swept under the carpet. I feel now all of us in this webinar are accountable since it was raised. I feel that the NACCW should respond to protect the workers and children as this is a safeguarding webinar. Safeguarding should be the core business of all child and youth care centers. And then there is the last one, I believe. Okay, Melita, social worker at Free State Department of Social Development, Lerato. I am registered with NACCW. I have emailed requesting membership number in order to pay for this year, but there is no response to date. Is it possible to also send me the information? Please, Melita, respond on that WhatsApp number that I have given you. And if you're not able to, we'll definitely follow through with you on this email address that you have provided. Okay, the other one also is asking about the membership and okay, that's from me. Okay. It's important to link the safeguarding policies and the values and principles of social service workers. Remember that it's not there to police us, but to protect us, and as well as the children that we serve. That's from Tembelihle Mluli. Thank you very much. Nicia, I'm not sure if you want to speak on any point that I raised from the chat box, and then Zeni. Thank you.
Yeah, so the dispensary, I mean, it's a fair question. I'll have to just check. Nothing is jumping into my mind about medication giving them to the children at school and what are the do's and don'ts, but I'm sure there is some document or guidelines for it, and we can dig around and see what that is. And then, so I don't have an answer for that one, but we can look into it. And then the other comment about the swept under, so child safeguarding is definitely a key aspect for all organizations, for all child and youth care centers, and to promote good practice. And if good practice is not promoted, to try and enforce it with the relevant people, board members, as much as possible. And if correct reference checks are not taking place, to approach the HR person or whomever and say, okay, but this is not happening and we have this concern, and what is now the next step? And depending on the outcome of that, discussions with the relevant heads of the organization and board members, and continued orientation with staff and the seniors of the organization. So I don't know if I'm missing any other comment. I think the last one, remember, it's not there to police membership. I think all the others were. I don't know if Zeni O'Donnell has any additional points.
Zeni, any additions from you? You are on mute.
No, except to say that when a webinar like this raises some very key questions that are coming out, like the dispensing of medication in schools, we will, like Nicia says, we need to take it forward and find out what would be the procedure there. And I think if we're implementing a new policy that, even though we know that safeguarding policy should be in place, but it maybe hasn't been operationalized, when we work and partner with other organizations in implementing it, we need to build that level of collegial understanding of what we're doing, so that we actually, the partnership and the elements of the safeguarding policy transform others in that in the partnership. So I think if you look at that issue of the school, there's work to do there to discuss that with the education department, find out what are their policies that make it difficult, and find a way of actually resolving it. Because I think that one could certainly be resolved. And it seems like, as I said earlier, we have to get our board members involved and our management teams involved. And I think more broadly as the NACCW to see how we can support each other in this process of implementing the safeguarding policy, with its adjustments for our own programs. And I've seen, Donald, a lot of people asking for membership application forms. And I think you've been responding, because that would be very helpful. Because I think Nicia mentioned the POPIA Act, and she mentioned the Child Protection Policy. And these are documents that we can look at a very sort of like good strategy of sharing, so that we actually, in a way, work together in strengthening our membership in this way. Thanks.
Thank you. Thank you very much, Zeni. And thank you very much, Nicia. I don't see any other comment or a hand. And if anyone does, please just help me by pointing me to the right direction. We seem to have come to the end of this webinar. But before I hand over to okay, there is another question that is being asked there. In case of a learner that is pregnant in school and they go to labor, who must write a report? Maybe Zen, before I wrap up, do you want to respond to that one? Maybe in this case, we can use the Isibindi Ezikoleni as a guiding program that we have in schools.
Yes, I think that if there are child and youth care workers in schools, and it would be a delegate task that could be provided to them by the school principal, but it has to be done in consultation. It could be that there are others that would take that responsibility, or preliminary report of what happens can be done by the child and youth care worker, but officially presented by the school principal for record purposes. I think that as child and youth care workers, being given opportunities in school to expand our role, our importance, and be supportive in these kinds of matters is a very positive opportunity. It actually helps the school understand, school principals and educators, that we have a significant role to play. And if we need to clarify a little bit more in partnership with school principals, I think we need to do that. It's all about communication. Thanks, Donald.
Thank you. Thank you very much, Zeni. Yes, we have come to the end of this webinar. It surely was a very relevant webinar that we are holding. And I want to just put forward a request that if the sector feels there is a particular area of work that you would want us to hold a webinar on, please do send us that information. I have provided an email address, donald@naccw.org.za. You can send to that email address, or you can send a message to the WhatsApp number that we have provided. We'll look into that and see if the topic is broad enough that it will be able to appeal to the sector. But the reason we are having these webinars is so that the sector is provided with required knowledge to help us practice better as child and youth care workers. So just a few points that I have noted. it's that this webinar, the safeguarding policy, we are saying it's very important, and your organization may not have it, may not have a safeguarding policy, but now you have been alerted that it's a document that is necessary. And if you are sitting in management, you can have this point on the agenda so that it is discussed by your management. And if you are a child and youth care worker, I'm sure that you have been informed now, and you can use other means within the organization to alert the organization that there is such a policy that is very important. And we are saying that this outlines an organization's commitment to keeping children safe from harm, and that it needs to be clear with clear steps. It needs to have a clear code of conduct in it, and it must be reviewed, because some organizations have policies that sit and then they gather dust and they are never read, trained, or even reviewed. And it needs to be linked to critical regulations. That's very important. And you heard when Nicia was presenting that she also mentioned the Children's Act and other acts. The webinar benefits you as a child and youth care work practitioner, as well as management of an organization, or as a board member of an organization if you are attending as a board member. And we believe that this webinar was able to distinguish between the child safeguarding policy and the child protection policy. And that has been clarified, and that both of them are necessary to have in an organization. We're also saying that organizations must have policies. These policies must be trained and must be implemented. It's very important for your own growth as a child and youth care worker, as well as for your own safety and the protection of children as well, because the reason we have these policies is so that the children are better protected. So as we indicated, we are going to be sharing this PowerPoint presentation, but we indicated that preference is that we share information, documents like this to child and youth care workers who are active members of the NACCW, because we can even assist you in ensuring that this is taken forward in the provinces. But if you are a non-member, we do not have much means to reach you, or even to connect you to a broader group of people who can support you. So if you are not a member of the NACCW, please use the information that we have provided so that we can send you a membership form and you can join and be a member. I am now going to hand over to Josie to do a vote of thanks. And yes, Josie, I'm handing over to you. Josie is the provincial chairperson in the Northern Cape, just so you know. Thank you. Josie, are you on? I saw Josie was on before, but if Josie is not coming through, I am going to render that item. Okay, it looks like Josie may not be connected. Northern Cape tend to have some challenges when it comes to network. So on behalf of the NACCW, I would like to thank Nicia for this presentation, as well as NACCW for sharing this critical information with the sector. It is information like this that helps organization, but it also strengthens us as child and youth care workers. So I believe that we are going to use this as information that moves our organizations forward and also develop us as child and youth care workers. Like we indicated, we are going to be sharing these kind of documents with the sector. And if you are not having access to them, please feel free to connect with us. If you are from a province, if you are a member of the province, make sure that you participate in the provincial activities. In this month and next month, we are having provincial BGMs, and we would like to thank all those child and youth care workers who are taking part and presenting themselves to continue in developing the provincial structures. So thank you very much, and thank you very much to Zeni, and thank you very much to all the child and youth care workers, to Christina, who joined us this morning from Sweden. We appreciate your presence. I also want to indicate that we have seen that our videos are going far beyond South Africa. We are seeing other countries accessing them and trying to understand what we are doing and learning from them. Jonathan, thank you very much for your time and the role that you played in opening this webinar. I would like to wish everyone a continuing happy Heritage Month. I hope that you are going to be further enjoying yourselves over the weekend. And from myself, thank you. Thank you very much. I would also have closed the webinar as the program director. So have a good day and enjoy yourself this afternoon. Thank you.
Thanks so much, Donald. Thanks, everyone.
Thank you.
Bye.
Thank you.
Colleagues.
No, thanks and goodbye.